Welcome to our channel. Today we want to look at the rehabilitation process for someone with speech impediment. If somebody loses his ability to speak after stroke, how do you restore his ability to speak again? You must recommend such individual to a speech therapist, or you recommend him you recommend speech therapy for him, whereby he will begin to learn how to speak on a gradual process. He might start with some simple alphabet, pronunciation of some simple alphabet. Then later, he will begin to practice pronouncing simple words, simple letters. Then, you can introduce some simple passages for him to read. And they must practice reading aloud to the hearing of another person so that he will be corrected when he is not pronouncing it correctly. You can also recommend chewing gums for such individual. How does chewing gum come into play here? And how does it help this situation? Of course, chewing gums will help the person to exercise the muscles of the jaw. And as he's exercising the muscles of the jaw, it becomes more, the muscles of the jaw will become more flexible. And this will assist him while he is trying to pronounce things that are difficult for him. You can also recommend singing for such individual. You can go ahead and sing for him while he follows behind. And when he's not getting it right, of course, you are in position to correct him. So with such practices, he will be coming up gradually, day by day. Then another thing that you can do to assist that person, we mentioned massage therapy previously. Where do you massage this time? You still tap on the arteries by the side of the neck. Remember, we said previously that this exercise will help to open up communication. Then you will also massage the muscles of the jaw, because in most cases, opening their mouth will be very, very difficult. And if somebody cannot open his mouth clearly, he won't be able to pronounce things correctly. So with this massage therapy, that you will concentrate mostly, with this massage therapy that will be concentrated either within the muscles, the jaw position, or the arteries by the side of the neck, that person will have more flexibility when he is speaking. And the same exercise will help to open up communication. So how long will you engage him in this form of exercise? Of course, it depends on the person's response. The way Mr. A responds might differ from the way Mr. B will respond to the exercise. So the exercise will go on as long as the situation remains in him. It might take some few months, it might take a year, it might take 2 years. But the fact is that improvement will be on gradual process, and you will see it clearly that the person is responding to the therapy. What if a person is partially paralyzed or having paralysis in one side of the body? What form of help will you give to such individual? Watch out for our next video.